Dr. Christopher Gray, the Associate Professor in the Departments of Chemistry and Biology at the University of New Brunswick and St. John, the Adjunct Professor in the Departments of Chemistry and Biochemistry at the Université de Moncton.
The area that we're working in, there are a couple of areas that I think we are now getting quite a reputation for. One of those is working on the endophytes that are found within plants, and I do that in collaboration with John Johnson at UNB. And endophytes are microorganisms that live inside the plants. So we're at the stage now where we can isolate compounds that are biologically active from medicinal plants, but we don't really know whether the plant is producing those or a fungus living inside the plant is producing those. So we're looking at those two things in concert, and I think we're pretty good at isolating these endophytes and working on those. The other area I would say that we're doing really well with is the tuberculosis research, which we're doing in collaboration with Duncan Webster at the St. John Regional Hospital. Obviously, there's an obvious need for new tuberculosis drugs. It's a third of the world's population has tuberculosis, and we need new drugs to treat that. So we've actually developed, or we've optimized a bioassay that is allowing us to isolate compounds that are very good at inhibiting the growth of tuberculosis. Our research is mostly lab-based, but we're focusing on natural products from medicinally used plants. So we do a little bit of field work to collect those plants all around New Brunswick and the Maritimes, really. In the Canadian perspective, there's this massive amount of knowledge relating to the use of plants as medicines by the First Nations. They've been doing it for thousands of years. But that hasn't really been followed up scientifically as much as other areas of the world. So we're kind of working our way through these medicinal plants. We're looking at the endophytes that are in them, and we're seeing whether we can isolate compounds from them, which hopefully will become or inspire new drugs in the future. The mainstay of scientific research is the funding that makes it possible. In Canada, I think we're in a very fortunate position in that science is funded very well. On a federal level, we've been funded by NSERC, but we've got more support from provincial funding through the New Brunswick Health Research Foundation and the New Brunswick Innovation Fund. We need provincial funding, which will allow our researchers to do the preliminary work and then let them get those really big grants at the federal level